Hello everyone, I am Arkajyoti Bashak, a final year MBBS student from IPGM Hospital, and today our topic of discussion will be epidemiological studies. We will particularly focus on which study to choose depending upon the question given and what will be the rationale behind all of that. First we have to know the understanding of the basic, what are the types of epidemiological studies are. So, epidemiological studies can be broadly classified into two broad terms. The first experimental type of studies and the second observational type of studies. So experimental type of studies, we generally provide some intervention to alter or to bring out some change in a diseases or in some treatment outcomes. So it is kind of an intervention based study. And in observation studies, there are no interventions. So we can also call this as non-experimental study. I will be simply writing NE for non-experimental and E for experimental. So experimental study is not further subclassified and it has 3 or 4 parts which I will be discussing later. So observation study is further divided into two subtypes. The first one and the second one. The first is a descriptive type of study and the second is the analytical type of study. Sorry for the interruption, guys. So, the descriptive and analytical are two subtypes of the observational type of studies. So, descriptive type of studies is further subdivided into case series, and case reports. In descriptive type of study, we study the disease and its variation with the time, place and person and not typically the etiology or the risk factors. When in analytical study, we generally study about the risk factors or the etiological features of the particular disease. So the analytical studies can now be subdivided into case control, second, cohort studies, cross-sectional, and fourth, ecological. Cross-sectional at times is also known as prevalence study. So now we have the basic idea of what all those type of studies are. And in experimental type of study, there are 3 subtypes. The first is the RCT, which is the randomized control trial. Second, there is community trial. There are many other, but we will consider one more, field trial. So these summarizes the types of epidemiological studies. So now when we have the idea of all the types of studies, we will be studying the first topic of today, that is the case control. Case control study. So as it is evident from the name, case and control. So the case and the control. Both these consider same group of people with similar age, similar type of sex and all of that. But there is a difference. What is the difference? The difference is in the case, the person is a case of that particular disease. So disease is present in this. It can be any disease or it can be any condition, and here the disease is absent. And when we have the two groups of people, that is case under control, we will inquire them or ask them whether they had any risk factor associated with that. Where RF stands for the risk factor. So evidently we are going into the past. At present, the person has the disease and we are asking about him whether he had exposure to the risk factor at a past stage. So we are going into past. If we think it from another point of view, at the past stage, the person had the risk factor. It can be acquired, it can be anything. And then he developed a disease. I am considering this from a past point of view. So this risk factor becomes the cause. And the disease is the effect of the cause. So in case control study, we are going actually backwards. It is effect to the cause. And hence this is also known as backward study. Let me give an example for you to make it clear. So consider here, I will take the condition of the disease lung cancer. So group A has lung cancer while group B does not have lung cancer. So A becomes the case as the disease is present and B becomes the control as the disease is absent. So now we will study the risk factor associated with here is smoking. So we will inquire whether the persons in group A and group B have smoked or not. Clear? So lung cancer, whether the person is suffering from lung cancer, whether he has smoked or not, and whether the person is not suffering from lung cancer, who has also smoked or not. So at present the person may or might not be suffering from the lung cancer, but we are asking about him whether at past he has smoked or not, or from past he has started smoking and still he is continuing or not. It is very much clear, I suppose. मतलब कि एक बंदा जिसको लंग कैंसर है अभी, हम उससे पूछेंगे कि उसने स्मोक किया है कि नहीं, और कितने सालों से किया है वो बाद में बात आता है, लेकिन उसने स्मोक किया है कि नहीं, तो अभी उसको लंग कैंसर है। वो स्मोक कर रहा है कि नहीं, मतलब अभी इफेक्ट, अभी कॉज हो गया, इफेक्ट हो गया, और हम लोग पूछ रहे हैं कॉज के बारे में। और एक ऑप्शन हो गया कि लंग कैंसर उसको अभी नहीं है, हम लोग उसको पूछेंगे कि तुमने 10 साल पहले या 20 साल पहले सिगरेट स्मोकिंग किया था कि नहीं। सो दिस इज वेरी मच क्लियर अबाउट द केस कंट्रोल स्टडी. And second, there is cohort study. So now we will be dealing with the cohort studies. In cohort studies, we are concerned mainly about the risk factors. So again, we will divide the people or the groups or the whole community into two groups for our purpose. First will be group A and second will be group B. So in group A, we will consider the fact that risk factors are present, and in group B, the risk factors are absent. And then, so this becomes the cause. So now we have two options. First, to follow up them for around 10 to 30 years or 20 years, for any time, any amount of time. And then in the future, an event will occur, which in this case is a disease. So this is the effect. So we are going from cause to effect. And there can be another option where we will be going backwards, not backwards actually, but not in the future, but we will be going into past. And then again, a disease which will be effect, and then again the cause to effect. In case control, we studied about exactly the opposite thing, but here the cause to effect and cause to effect. So you now might have an answer or question or a doubt that we are also going past here. Why is this not case control? This is actually called retrospective cohort. And how is it different from case control, I will explain through example. So this is retrospective cohort. And this is prospective cohort. And when we combine both these two, retrospective and prospective, it leads to the formation of another cohort system which is known as ambispective cohort. So now let's have an example. For example, we are taking two groups, group A and group B. In group B, risk factor is present, and in group B, risk factor is absent. For suppose we consider this information taken from a medical record of any college in the year 2010, and then we follow up them for 15 years, and then we study whether disease has happened or not in the year 2025. So this is a prospective cohort in which we are following up them. This is the cause, this is the effect, and there is cause to effect. So this is prospective cohort. In the same type of condition, we are taking the medical records again from 2010. So, and now we are studying whether this risk factor has led them to the causation of COVID-19 in 2021. So, although this is past, but if we consider from the records of the medical records, this is also from the records, this is also from the records. So, this is 2010 to 2020-21, and this is 2010 to 2020-25. So, we are actually going into the past considering 2005, but in terms of the medical records of the 2010, it is in future only, 2021. So this is the retrospective cohort and this is prospective cohort. So now when we have an idea of all this stuff and we have a basic understanding of all the studies, I would like to discuss some case scenarios for a further better understanding. So the first question, the questions will be given in the description box, so you did not need to worry about that. Many cases of silicosis were reported from a pottery and ceramic industry. Which type of epidemiological study should you plan? So it says many cases of silicosis. Silicosis is a disease. And it is stated many cases are already reported. So the disease has already happened. So the effect is already there. And the cause will be exposure to silica dust from the pottery and ceramic industry. So this is typically going from effect to cause, and hence the first question that I am discussing will be case control study. Now the second question. A study is conducted in a community block of West Bengal on the risk factors of non-communicable disease among young adults over a period of 5 years to find out incidence of hypertension, diabetes mellitus, stroke and cancer. So it is clearly mentioning that there are risk factors of non-communicable diseases and we are following them for a period of 5 years. So it's absolutely clear from the statement that this is a kind of cohort, because we are following them up for a period of 5 years in the future. So this is a case of cohort. Now the third one. Design a suitable epidemiological study to test the association between oral tobacco intake and oral cancer. Oral tobacco intake and oral cancer. So here the disease is given, but it is not mentioning that there are cases reported, and it is also said, and it is only told. There is mentioned that we need to test the association between oral tobacco intake and oral cancer. So the association is to be tested. So it is not clearly referring to that whether the disease was already present before or whether we are following up. So we can consider that this can be a case of both case control or this can be a case of both cohort. If we consider the case of case control, then oral cancer will be there first, and then we will be taking the oral tobacco intake history from the past. And if you're doing a cohort, then we will be studying whether the oral tobacco intake was there in the medical record, and we'll be following them up for 15 years for oral cancer. But what do you think the answer will be? These cannot be both. In practical terms, this will be a case of case control study. Because case control study requires very less amount of time, less manpower, and it is very easy to be done. While case cohort needs a large amount of money, large manpower, and requires a large amount of time. Also, there is a problem of ethics in here. If we give a person oral tobacco and then we study oral cancer for our purpose of research, but instead we are harming him. We are giving him tobacco and then we are studying whether he will develop oral cancer or not. So this is harmful for the patient or the person we are choosing in. But in the case control study, the person is already suffering from oral cancer. And then we are asking him whether he has risk factor of tobacco intake or not. So there is no question of ethics in here. So this is a case of case control study based on the practical aspect of view. So the fourth question, a renowned tertiary care center in Kolkata wants to test the efficacy of a new drug in the treatment of pneumonia against the standard treatment regimen. Suggest an appropriate study design for this study. So, testing the efficacy of a new drug in the treatment of pneumonia. So this is an interventional kind of study. We're giving a drug and we're testing the efficacy in the treatment of pneumonia. So this is an what? Exactly. This is an interventional type of study, and the most common of them are randomized controlled trial. So we will be doing an RCT for this. The last question. We have come across preliminary reports that administration of high dose of vitamin C may help reduce the mortality in cases of COVID-19. As a healthcare researcher, how will you proceed to design and conduct the study? To either prove or disprove the reports, what will be the study design? So this question is also similar to the previous question. We're doing some intervention like high doses of vitamin C might help to reduce the mortality of cases of COVID-19. So this is again a case of randomized controlled trial. I hope this is very much clear, all the case scenarios and all the epidemiological studies. If you have any further doubts, you are free to ask in the comment section. Thank you for today.